The silent burn, 6 signs that could indicate GERD. Gastroesophageal reflux disease, commonly known as GERD, is a prevalent digestive disorder affecting millions of individuals worldwide. GERD is a chronic condition characterized by the backflow of stomach acid into the esophagus, leading to irritation and inflammation of the esophageal lining. This reflux of acid occurs when the lower esophageal sphincter, a muscular valve between the esophagus and the stomach, fails to function properly. GERD is a widespread condition, with its prevalence varying across different regions and populations. It is estimated that approximately 20% of adults in the United States experience symptoms of GERD at least once a week. Furthermore, GERD is not limited to adults and can also affect children and adolescents. GERD is primarily caused by the dysfunction of the lower esophageal sphincter, which is responsible for maintaining the one-way flow of food and stomach contents from the esophagus to the stomach. When the lower esophageal sphincter fails to close properly or relaxes abnormally, stomach acid can reflux into the esophagus, leading to irritation and inflammation of the esophageal lining. There are several factors which can predispose individuals to develop GERD. These include hiatal hernia, a condition where a portion of the stomach protrudes through the diaphragm into the chest cavity, weakening the lower esophageal sphincter. This weakening allows stomach acid to reflux into the esophagus more easily, contributing to the development of GERD. Hiatal hernias can be congenital or develop over time due to factors such as age, obesity, or increased intra-abdominal pressure. Excess body weight, particularly in the abdominal area, can put pressure on the stomach and the lower esophageal sphincter, or LES, leading to increased intra-abdominal pressure. This pressure can cause the LES to relax abnormally, allowing stomach acid to reflux into the esophagus. Studies have shown that individuals who are overweight or obese are at a higher risk of developing GERD compared to those with a healthy weight. Hormonal changes during pregnancy, particularly the increase in levels of the hormone progesterone, can relax the LES. As the uterus expands to accommodate the growing fetus, it can also exert pressure on the stomach and LES, further contributing to reflux. Pregnancy-related symptoms such as heartburn and acid reflux are common, with up to 50% of pregnant women experiencing these symptoms. Tobacco use has been linked to various gastrointestinal issues, including GERD. Smoking can weaken the LES and impair its ability to function properly, allowing stomach acid to reflux into the esophagus. Smoking stimulates the production of stomach acid, worsening reflux symptoms. Some medications can contribute to the development or aggravating of GERD symptoms. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen, can irritate the esophagus and increase the risk of erosive esophagitis. Likewise, calcium channel blockers, used to treat conditions like high blood pressure, can relax the LES and promote reflux. Furthermore, certain antidepressants, sedatives, and tranquilizers can also have similar effects on LES function. Signs and symptoms of GERD. GERD presents a variety of symptoms, ranging from mild discomfort to more severe complications. Understanding these signs and symptoms is crucial for early detection and effective management of GERD. 1. Heartburn. Heartburn is the most common symptom of GERD, characterized by a burning sensation in the chest behind the breastbone. This discomfort often occurs after eating, particularly after consuming acidic or spicy foods, and may worsen when lying down or bending over. Heartburn can sometimes be mistaken for a heart-related issue, but it typically improves with antacids or acid-suppressing medications. 2. Vomiting. Another prominent symptom is regurgitation, or vomiting, which is when the stomach contents, including acid and food particles, move back up into the throat or mouth. Individuals with GERD may experience sour or bitter-tasting fluid in the mouth, often accompanied by a sensation of fluid coming up into the throat. This regurgitation can occur spontaneously or be triggered by bending over or lying down after a meal. 3. Difficulty swallowing. Dysphagia is another clear symptom of GERD. Dysphagia refers to difficulty swallowing or the sensation of food getting stuck in the throat or chest. In GERD, dysphagia may occur due to inflammation or narrowing of the esophagus caused by chronic acid exposure. Individuals with severe dysphagia may need to modify their diet or undergo medical interventions to alleviate symptoms and prevent complications such as choking. 4. Chest pain. Chest pain associated with GERD may mimic symptoms of a heart attack, leading to confusion and anxiety. However, GERD-related chest pain is typically located behind the breastbone and may feel like a burning or squeezing sensation. Unlike chest pain due to a heart attack, GERD-related chest pain often occurs after meals or during periods of increased intra-abdominal pressure. 5. Chronic cough. A chronic cough is a common symptom of GERD, particularly when acid reflux irritates the throat and airways. Individuals with GERD may experience a persistent cough, especially at night or after eating. The cough may worsen when lying down or during physical activity and may be accompanied by hoarseness or throat clearing. 6. Chronic irritation of the throat. Acid reflux can lead to hoarseness, a rough voice, or a persistent sore throat. Individuals with GERD may experience symptoms of throat irritation, such as a scratchy or dry throat, coughing, or the sensation of a lump in the throat. These symptoms can all vary in severity and frequency, and their impact on daily life may differ from person to person. Complications arising from untreated GERD. If GERD is left untreated, it can lead to several potentially serious complications, primarily due to chronic exposure of the esophagus to stomach acid. Some of the most common complications include A. Chronic inflammation of the esophagus caused by repeated exposure to stomach acid can lead to a condition known as esophagitis. This can cause irritation, pain, and difficulty swallowing. B. Long-term inflammation of the esophagus can result in the formation of scar tissue, leading to narrowing or strictures in the esophagus. This can cause difficulty swallowing and may require medical intervention to alleviate. C. In some cases, chronic GERD can cause changes in the cells lining the esophagus, leading to a condition called Barrett's esophagus. Barrett's esophagus is a precancerous condition that increases the risk of developing esophageal cancer. D. Chronic exposure to stomach acid can cause ulcers to develop in the lining of the esophagus, leading to pain, bleeding, and potential complications such as perforation. E. GERD can intensify existing respiratory conditions such as asthma or chronic obstructive pulmonary disease, or COPD, leading to worsening symptoms and increased risk of respiratory infections. The complications of untreated GERD can have a significant impact on an individual's quality of life and overall health. Diagnosis of GERD. Healthcare providers conduct a thorough review of medical history, focusing on symptoms like heartburn, regurgitation, chest pain, difficulty swallowing, and associated factors such as diet, lifestyle habits, and medications. A physical examination may be performed to assess for signs or symptoms of GERD, such as abdominal tenderness, chest sounds, or inflammation. Diagnostic tests of GERD. The first diagnostic test is endoscopy, which involves the insertion of a flexible tube with a camera into the esophagus to visually inspect its lining. It allows direct visualization of the esophageal inner surface to detect signs of inflammation, erosions, ulcers, or other abnormalities associated with GERD. Endoscopy helps confirm the diagnosis of GERD by providing direct evidence of esophageal damage. The second important diagnostic test is esophageal pH monitoring, which measures the pH levels in the esophagus over a period of time, typically 24 to 48 hours. It helps assess the frequency and duration of acid reflux episodes, providing quantitative data on the severity of GERD. Persistent acidic pH in the esophagus supports the diagnosis of GERD, indicating abnormal acid exposure. A third test for diagnosis of GERD is esophageal manometry, that evaluates the strength and coordination of the muscles in the esophagus. It assesses esophageal motility and function, detecting abnormalities such as weak or ineffective contractions. Abnormal findings on esophageal manometry indicate underlying motility disorders or dysfunction contributing to GERD symptoms. The last diagnostic test is barium swallow X-ray. This involves swallowing contrast liquid barium, which coats the esophagus and stomach. X-ray images are then taken to visualize the esophagus, detecting structural abnormalities or reflux. Barium swallow X-ray can reveal structural changes such as hiatal hernia or esophageal strictures, supporting the diagnosis of GERD. It's essential to differentiate GERD from similar conditions such as peptic ulcers or gastritis. Treatment options for GERD. GERD can be effectively managed through a combination of lifestyle modifications, pharmacological treatments, and surgical interventions. Each treatment option aims to alleviate symptoms, heal esophageal damage, and prevent complications associated with GERD. Let's explore 5 lifestyle modifications that can facilitate the prevention and control of GERD. 1. Maintaining a healthy weight through diet and exercise can help reduce intra-abdominal pressure, thereby decreasing the likelihood of acid reflux. 2. Sleeping with the head of the bed elevated by 6 to 8 inches can help prevent nighttime reflux and alleviate symptoms. 3. Wearing loose-fitting clothing can reduce pressure on the abdomen and LES, minimizing the risk of reflux. 4. Tobacco use can weaken the LES and increase stomach acid production, making reflux more likely. Quitting smoking is essential for managing GERD symptoms effectively. 5. Lying down shortly after eating can increase the likelihood of acid reflux. To prevent nighttime reflux, avoid eating large meals or heavy snacks before bedtime, and allow at least 2 to 3 hours for digestion before lying down. Dietary modifications to reduce GERD risk. Healthcare providers advise certain dietary modifications to reduce the risk of developing GERD. This includes 1. Avoiding trigger foods that can exacerbate GERD symptoms, such as spicy, acidic, or fatty foods, can help reduce reflux. Instead, focus on consuming smaller, more frequent meals and incorporating foods that are gentle on the digestive system, such as lean proteins, vegetables, and whole grains. 2. It is also recommended to use high-fiber foods, such as fruits, vegetables, whole grains, and legumes, which can help promote digestive health and reduce the risk of GERD by improving bowel regularity and reducing intra-abdominal pressure. 3. As acidic and spicy foods can irritate the esophagus and exacerbate GERD symptoms, limiting or avoiding foods such as citrus fruits, tomatoes, onions, garlic, and spicy seasonings can help reduce reflux. 4. Furthermore, high-fat foods, fried foods, and fatty meats can delay stomach emptying and increase the risk of reflux. Choosing low-fat or lean protein sources, such as poultry, fish, and plant-based proteins, can help minimize reflux symptoms. 5. Stay hydrated by drinking water throughout the day that can help dilute stomach acid, making it less irritating to the esophagus. It also helps with digestion and keeps the digestive system functioning properly, reducing the likelihood of reflux. 6. Chewing sugar-free gum after meals stimulates saliva production, which can neutralize stomach acid and clear it from the esophagus more quickly. Saliva also contains bicarbonate, which helps neutralize acid. 7. Limit your alcohol consumption, as alcohol relaxes the LES and increases stomach acid production, making reflux more likely. By limiting or avoiding alcohol, you reduce the risk of LES relaxation and excessive acid production. There are several pharmacological treatments for GERD, but the simplest are over-the-counter antacids, such as calcium carbonate or magnesium hydroxide, which can provide quick relief from occasional heartburn by neutralizing stomach acid. If you experience any symptoms of GERD or have risk factors for the condition, it's essential to consult with a healthcare professional. Early detection and treatment can improve quality of life and help slow the progression of GERD to more serious complications such as esophagitis, strictures, and Barrett's esophagus, which can increase the risk of esophageal cancer. To learn more about this and other common illnesses, please like this video and subscribe to Curativity. Thanks for watching, and until next time, take care.